and not those of radio station KICK. Vision Communications Incorporated, its management, or advertisers. Vision Communications Incorporated is not responsible for the validity or accuracy of information presented on this program.
Wellness Wednesday with Dr. Norm Shealy and Dr. Shealy-Sorin. Get the health answers you need from the creator of Holistic Medicine and the 2020 Holistic Doctor of the Year. To be a part of the show, call 417-447-1777. Wellness Wednesday. Now, here are your hosts, Dr. Norm Shealy and Dr. Shealy-Sorin.
Hold on, I think we were talking during the music there. I'm not sure if that came through.
Okay,
so,
one more.
Good
afternoon. Today it is holistic pain care.
Yes.
That's what started this whole business. That came before holism.
Yes.
Back in the days when I was in my neurosurgical residency, neurosurgeons since the early 20s, and this was in the late 50s to early 60s, neurosurgeons were cutting the front half of the spinal cord with a razor blade, an old single-ended razor blade, broke it off and cut the front half of the spinal cord with it. Now, it worked for pain on the opposite side of the body about 80% of the time, but 10% of the time it paralyzed that leg, 10% of the time it paralyzed your bladder and bowel, 100% of the time you never had another orgasm, and within 5 to 7 years the pain returned.
Wonderful.
Other than that, Mrs. Lincoln, that was the play. That is what led me to look for an alternative to that barbarian crap.
Mm-hmm.
And so when I finished my residency, I spent 3 years studying pain physiology in cats. And finally, I found that if we used electrical stimulation of the spinal cord itself or of the skin, we could block all pain transmission to the brain. And when I presented this to the American neurosurgical community, they jumped up the stage and grabbed the microphone and called me an idiot because it was animal research. 3 years later, when I did, I think 6 patients by that time, and I talked about my success in patients, every neurosurgeon in the room wanted to do the procedure. So we set off to prove that it was, long-term a good thing. On the other hand, all of a sudden, I was being sent 400 patients a year for the spinal cord stimulator, like a pacemaker of the spinal cord. Now, if they had not had 4 to 5 unsuccessful surgeries and were not on Valium and Percodan, 2 of the worst enemies in the world, I would have done it. But I actually only accepted 6% of the patients for the procedure. I thought the others were far too damaged. So on October 15th, 1971, I founded, quote, the Pain Rehabilitation Center, the first, to my knowledge, major pain center run by a physician.
It is the first. Yeah.
And over the next couple of years, I learned about biofeedback and autogenic training. Went back and got a PhD in psychology to study this self-control thing. And in 1979, then we founded the American Association of Holistic Medicine. Interestingly, from the beginning, the establishment hated it. They wouldn't allow us even to advertise for the founding meeting. And they started calling it complementary and alternative.
Just want to say something, and I'm not going to go further in this because for a number of reasons, but isn't it interesting how some sort of censorship has existed on the good things since a very well...
Well, that's true in every field that I've been able to.
Yeah.
Change is not welcome.
No.
In fact, actually, a former neurosurgical friend of mine, wrote an editorial criticizing the leaders of the holistic movement as being too charismatic and speaking too well.
Oh my God, that's a crime. Terrible.
And then he said, and furthermore, we're too busy taking care of disease to try to prevent it.
So in other words, don't worry about the guy throwing people off the bridge. Just keep saving the people on the water, right?
Yeah.
Okay, yeah.
And interestingly, the idiots who took over, I retired after 2 years, I'm not a lifelong person, that kind of thing. But the people who took over 5 years ago, absolute, skunks. I could call them a few other things, but maybe I can't say that online. At any rate, they changed the name from American Holistic Medical Association to the Academy of Integrative Health and Medicine. I refuse to transfer my lifetime membership. I am opposed to the idea of integrative medicine because it sucks. It is false nonsense 99% of the time.
Hmm. The label is used by pretty much anybody or everybody who.
They introduce a blister and create a huge burn, but call it integrative.
Mm-hmm.
The local hospital said they had a department of integrative medicine. They offered hot stone massage. I'm not opposed to hot stone massage, but it's hardly integrative. It's certainly not comprehensive and ain't nowhere near holistic.
Yes.
So I still like the word holistic because what it means is holy and comprehensive and complete, body, mind, and soul. And that's where medicine went wrong several hundred years ago when they kicked soul out of everything to do with medicine.
Mm-hmm. The separation of the mind, the body, and of course
the real person.
And the real person is gone, basically. Yeah.
And so, at any rate, by 1979, when I created the American Holistic Medical Association, I'd already introduced also cranial electrical stimulation for depression and anxiety. And gradually, I was, by that time, already using photostimulation to help calm the mind and the body. And of course, then through the years, we've elaborated upon the autogenic training, the foundation of which I built biogenics. And we eventually also created the gamma PEMF, pulse electromagnetic frequency device. We did all of this, all of these electrical devices and acupuncture, by the way. I forgot to mention that I started doing acupuncture in the 1950s.
And electroacupuncture as well.
And I introduced the concept of electroacupuncture, I think 1972. And when the first Chinese visiting physicians came to this country, they knew about me and electroacupuncture. They came to visit. They wanted to learn about electroacupuncture because they still were sitting there twirling the needles instead of electrifying them. All of this is part of the whole. And all the stuff we've added, as far as I can tell, is safe.
Mm-hmm.
Compared to any drug, including aspirin, we do not have any tool in holistic pain control that even comes close to the harm of aspirin, ibuprofen, NSAIDs, NSAIDs. I have trouble pronouncing that word.
Yep, NSAIDs, basically, yeah. Non-steroidal anti-inflammatory, yes.
And, of course, every other drug, because they start with the possible complications. It's so-called side effects, which is usually a relatively small percentage of death. Although, as I was taught in medical school, even back in the late 50s to early 60s, 16,000 people a year in this country and then were dying from aspirin, from bleeding the gut.
Yes.
I don't know how many it is today, but I guess it's greater.
I see overdoses or intentional or unintentional overdoses for pain and otherwise. It's a pretty terrible condition. Also, overdoses on Tylenol, overdoses on...
and Tylenol, by the way, kills the liver, among other things.
Yes. On a regular basis. If you take it once, twice, I mean, it's okay, but everything in moderation generally is okay. Generally.
All of the NSAIDs cause colitis. Collagenous and lymphocytic colitis.
Exactly, and the other options that are available now, interestingly enough, the opioids, drugs, the
mood. They create more deaths than anything except alcohol, maybe.
And the other thing that's interesting in the healthcare system is pretty much anybody on chronic pain gets recommended or gets put on antidepressants.
Oh yes.
Which is now there's an interesting connection there, where there is, and I think it's worth mentioning that chronic pain, especially, is strongly associated with anxiety, depression, and all sorts of medical conditions, medical illnesses, metabolic, cholesterol, diabetes, stress disorders. Stress is behind 95% of everything. But interestingly enough, the healthcare system is not addressing the underlying reasons and underlying root causes of all these things or interconnection between them.
I saw a young woman who is pregnant, and she's been put on an antidepressant.
Ah,
And she wants to get off it as quickly as possible. And
of course.
I agree with it.
Yes.
And my plan is for her to be off it within 2 weeks.
Wonderful.
Well, that's the way it is. Holism is comprehensive. And if you don't have a physician who will speak to you in more than 7 to 10 minutes,
Yes.
and I'm told that is the average physician's time with a patient,
5 to 7.
5 to 7, occasionally 10.
Occasionally
In
10.
an emergency almost.
Yes.
But even when I was back doing just plain old neurosurgery,
Mm-hmm.
I always demanded having an hour to see the patient
Yes.
to evaluate what I was going to do neurosurgically.
Wonderful. But that's taking the time to get to know the person, to understand.
Well,
to,
and
to
to
take,
get to know the whole picture, not just the person, but
yes.
you need the whole lifestyle.
Exactly. Because here's the thing. Holistic pain management, and we're talking not just acute care, acute pain. Now let's talk about the distinction between, this is really important, acute pain
And chronic.
and chronic pain.
Well,
That's a big difference.
Officially,
Yeah.
chronic is 6 months. Personally, I consider anything beyond 3 months to be the beginning, at least, of
That's
chronic.
exactly where I call it. 6 weeks. Yeah. 6 weeks, 6 to 8.
Well,
weeks.
3 months is actually 12. I mean,
12 weeks. But to me, and if it's not getting better after
Well, if
6
it's not getting
weeks,
better within a month, it's not going to get better with conventional medicine. Probably.
Exactly. But here's the thing: acute pain is a sign that something needs to be addressed. If a person is having pain, and I do want to emphasize this very strongly, if a person is having chest pain and they have heart risk factors or age or cholesterol, diabetes, blood pressure, guess what? Go to the hospital, get it addressed. It could be a heart attack. It could be
And
a
if you
clot. It could be a very number of various things. Could be pneumonia. Could be
And actually, even then, the next great complication is a stroke.
Exactly. But or a broken bone or something that, for example, what happened to me in a car accident. I broke my back, a lumbar spine. Now, in that case, I wouldn't recommend doing just meditations or relaxation techniques. You have to do something surgical in that case.
Yes, if you
which,
just try to treat the pain, you give up.
Exactly. So get to the underlying cause. Now, once the cause has been corrected, for example, I have now metal and my spine is still stabilized, and I'll just use myself as a personal example. This is actually about 12th week after post-surgery. And the interesting thing is, even though the acute pain was still present, was still there, it did not stop me from going back to the emergency room 3 weeks after the procedure.
Well, he is a tiger.
Well, it's my approach to pain is very different, and this is what we teach people. It's interesting. Pain to me, and please feel free to elaborate on this because this is part of the biogenics. Pain to me is a sensation. It's maybe an unpleasant sensation, and at times it can be more intense than others. But as long as it's not an acute damage happening in the body as we speak, I make the distinction. For example, I give that example. If I just had an accident and I'm hurting in my back and I don't normally have pain there, I got to check it out. I got to get some x-rays. But once I know that it's okay and it's a chronic pain, you can actually work with it, deal with it, and use mind-body techniques, as well as, of course, there's other things.
And let's face it, there are numerous techniques.
Mm-hmm.
Actually, let's look at what began to be the origin of chronic pain that was the founding of holistic medicine.
Mm-hmm.
That was actually failures of back surgery.
Yes.
I would say in those days, well over 90% of the patients that came for chronic pain management had anywhere from 2 to 5 unsuccessful back operations.
And how does that expression go? Einstein's
If the first one doesn't work, the second one has a higher chance of failing.
Insanity.
And the idea of doing 3 or 4 back operations, including fusions,
oh God,
to me that is insanity on the part of the surgeon. And it's falsely promising something to the patient. I wonder if anyone's ever been cured with 5th surgery on the low back.
Oh God, yeah.
And so, first and foremost, you have to find out, is there anything fixable?
Mm-hmm.
Now, I have to say that we don't see fixable things very often.
Not often.
Because that's an acute illness, and that usually is going to the hospital. And before they even think about holism, they've had surgery or opioids or antidepressants or anti-anxiety and all of them above. So But you do need to know that something is not wrong that can be fixed or should be looked at. Now, it often does require a different or additional tests, such as MRIs of the spine or of the brain, or CAT scans with contrast and all kinds of special testing, as well as some biochemistry. And the average physician knows, I would say, maybe 2% about nutrition.
Mm-hmm.
I'm amazed at how little they know about the need for food and vitamins and minerals and all kinds of additional food products.
But in not in defense, but in explanation, I got maybe half an hour of training on nutrition in the entire medical school
I
curriculum,
think
if that
I
much.
had the one or two sentences.
Gotcha. So we're not, as medical doctors, we're not trained, and unless we take an interest in it, it doesn't happen.
So, of course, the beginning of the worst of medicine
Mm-hmm.
was probably, was it 1910 or 12? The Flexner report was founded by the Rockefeller Foundation, one of the great criminals of all ages. And the result of the Flexner report was to throw out all competition with MDs.
Mm-hmm.
From the beginning, they wanted to throw out osteopathy and naturopathy.
Mm-hmm.
And actually, there was a homeopathic medical school in Philadelphia that was forced to be closed.
Mm-hmm.
And in most states, naturopaths are not even licensed today. I think only 19 or 20 states even allow them. And of course, the AMA fought chiropractic and naturopathy from the Flexner Report days until the mid 60s, when they lost a major lawsuit to the chiropractors in the mid 60s. And immediately afterwards, they actually passed a resolution to allow DOs, osteopathic physicians, to become MDs overnight.
Yes.
No difference in training. Now, they've been fighting them for 65 or 70 years.
Well, yes, you can beat them, just get them on your side.
Yeah.
That's.
And of course, many DOs gave up what I would call their paternity, so to speak.
Yes.
Because they stopped doing osteopathic in order to become more acceptable to MDs. And I got to say, osteopathy was actually the foundation for chiropractic.
Mm-hmm.
Andrew Taylor Still was an MD. He founded osteopathy. And a person soon to become a chiropractor came down and spent 2 weeks as a patient with Andrew Taylor Still and founded chiropractic.
Wonderful.
And it's good.
It's good. Yeah.
Chiropractic and osteopathy can be excellent.
And
so often I consider better than physical therapy. Physical therapy can be helpful.
Can be.
But better than physical therapy is the best kind of osteopathy or an excellent chiropractic.
Interestingly enough, along the lines of chronic pain and something easily fixable, if you're here in Springfield, by the way,
is a sacral shear.
Sacral shear. I just had a young lady travel about 3.5 hours to see me. Now, it wasn't just for sacral shear; it was for a wellness evaluation. It was well worth it. But sacral shear was got in 30 seconds.
Of course.
Yeah.
Now, it is only diagnosable by us, one or two physicians, maybe, who we've trained, and a real DO. And honestly, over the years, in thousands of people that I've evaluated for this, roughly about 15% of the population has a sacral shear that has not been diagnosed. Chiropractors don't know what it is. And MDs don't know what it is. So you can wind up with back surgery on a sacral shear when that was correctable in 30 seconds.
Actually, I saved a couple of my nursing colleagues from surgeries, literally, because they were just literally going under the knife, and I just corrected the malfunction. And but let's talk about all the we have a couple of minutes. Let's just kind of give a quick summary of everything that's pertinent in holistic pain management, all the factors. Just and then of course we have the next half an hour to talk, unless there's any questions.
Yes.
Yeah.
Well, the most important thing is being certain that the cause, if it is correctable, has been corrected.
Yes.
That's the most important thing of all. And second, then, is make a decision in what order to introduce autotech training in biogenics. It's always part of the whole.
Mm-hmm.
Then you have to think about, I rarely actually recommend acupuncture itself anymore because I can do the same thing with TENS.
Mm-hmm.
And with certain kinds of things, I can do the same thing with essential oils, like the bliss oils.
Especially the actually earth bliss.
Well,
Together
but
with
fire, air, water, earth, and crystal all have their biochemical and biological and psychological benefits.
Yes.
And spiritual.
Yeah.
And so all of these things have to be taken into account. And then you look at electricity, starting with the idea of either cranial electrical stimulation, introduced originally, founded by me. Actually, what happened is Saul Liss in 1975 brought me a stimulator he wanted me to use for pain. I said, take it away, it's useless. Well, please try it. So I happened to put it on my head and I saw flickering lights. I said, oh, this reminds me of Russian electrosleep.
Yes.
Russians introduced that about 1950. And indeed, it is better than the original Russian electrosleep. And that I proved that, and he changed it from a pain stimulator to a cranial stimulator.
Yes.
And that is very useful for pain and depression and insomnia. And then even by the time that I learned that, I already had learned from Jack Schwartz, a great psychic of all times, about photostimulation. And I was already using some devices that Jack Schwartz had made, and I introduced the Relax Made, which for 90+% of people will help you relax. That's good for anxiety.
And when a person relaxes, so let's go of anxiety, the pain threshold changes.
Oh, it goes down immediately.
So that's where there's a direct relationship between pain, stress, and anxiety.
Oh, absolutely.
Get those under control, and the pain gets better.
And of course, then eventually came my favorite of all times, the gamma PEMF. The only PEMF which puts the brain into gamma in the zone.
Yep.
In the zone means I am blissed, essentially. I feel great, I'm happy. And it, interestingly, does not only put you there, but it does modestly increase your anandamide, the natural bliss in cannabinoid.
Yes.
Okay? Cannabinoid.
Yes.
I have trouble with that word. But we do produce some, and in all disease, acute and chronic, you stop producing your own cannabinoids.
And interestingly enough, we'll have some time to take questions, but also talk more, but I just want to summarize real brief. There is a wonderful course on the holistic pain management that actually you and I put together based on how many decades of experience here. I've been, at this. Yeah. Well, I've been at it for about 2 decades now, but a wonderful, amazing course at only $49. The reason I'm saying it is because we wanted to make it accessible, and we wanted to let everybody know who is there with a chronic pain that there's hope, there's opportunity, and just because the conventional medicine does not have all the answers, it doesn't mean it was meant to have all the answers. So holistic pain management, it's possible. There's always hope. And, we'll continue the conversation after this second half. And questions. And we're on a break, but we still got
See if we have any questions.
Yeah.
Someone is asking what you think of using stem cells, especially in treatment for cancer.
I think it's definitely a good possibility with an experienced person. I also think they should consider exosomes. Exosomes are a lot simpler, a lot less expensive, and can work as well.
It can be a wonderful thing, but it can also be a contraindication in certain types of cancers, or you have to be careful because if stem cells, they go into whatever cells, whatever tissue they're needed. So you just have to be careful that it doesn't become a part of the problem. Other than that, I have seen reports of stem cells and exosomes being used. I actually used it acutely when I had my back injury. And that may be partially some of the factors together with PEMF and others that I was able to, at 3 weeks, function at the level of where 3 to 6 months is of post-recovery. as well as physical therapy and otherwise. But it's a plus minus on that one. If you're with experienced person, they know what they're doing. I would get the pros and cons, and I think it's an option. Any other questions, thoughts?
I think that's all the questions we've had so far. Lots of people saying hi.
Wonderful.
Okay, well, folks, remember,
Yeah.
you, the patient, are ultimately responsible for making the decision and trusting that what you get is going to be as good as it can be. Well, I don't want to do those to the break.
Yeah, that's fine. We'll do that.
Yeah, because I want it to get to the radio.
Yeah, let's get to and let's see if there's any other questions or thoughts. And we still have a couple of minutes here, do we?
Yeah, we still got a couple of minutes. No more questions yet.
No more questions
Okay,
yet.
so
Okay.
folks, think about what we are saying. That's so important. Think. Don't just listen and discard it. Cogitate. Play the pros and cons in your own mind. And always ask, what are the possible complications? What are the statistics? What kind of positive outcome statistics do you have, and what kind of probable or possible harm do you have?
Mm-hmm.
All of that's as important as anything else when you're choosing any therapy for anything whatsoever. Now, I have to tell you that personally, I do not, under any circumstance, recommend a psychiatrist unless you are truly crazy psychotic.
Mm-hmm.
I would refer somebody who's truly crazy psychotic to them, but anybody who's just simply neurotic or pain or whatever, I, under no circumstance, 100% of the time, will not recommend a psychiatrist. Psychology, mediocre most of the time. I wouldn't. When I went to get a psychology degree, I wouldn't even go to a standard psychology institution. I wanted to go to humanistic psychology. That's the real thing.
Well, that's the key. It's got to be the right field within psychology as well.
There's not a humanistic psychiatry.
Well, you're doing it with biogenics.
Well, but I wouldn't go near calling myself a psychiatrist.
No, that's not your title, but
psychotherapist maybe.
Well, close enough. I think technically.
We've got about a minute and a half, but somebody was asking if you guys have an opinion when dealing with cannabinoids, if you
Yes.
CBD oil or edibles with THC.
Oh, okay, I'll answer that question. Obviously the anandamide and all the cannabinoids are very important in the regulation of the body. There is an endocannabinoid system. There's a plant out there. Now, we don't recommend abuse of anything, or the use in underage kids, unless there's for example, epilepsy or some kind of a terrible condition that will qualify. But in adults who have chronic pain, it's a wonderful option, and I have no problem. I'm one of the doctors also who does the medical cannabis certifications. Again, it's not everybody's cup of tea, but I do find that it's a wonderful way to get off opioids and to improve mood and to get things in a better place in general. But interestingly enough, I just want to say, for those who are interested, putting the PEMF device with the cranial stimulator has put me in a place of, and I'm not sure how it compares to other things, but it literally made me feel like, wonderful, almost euphoric. And that's electrical stimulation. Have you had that experience?
Yes, I have. Actually put me to sleep.
We've got about 10 seconds until our
Okay, so that's another. But yeah, cannabinoid system, wonderful. Fully agree with it when it's appropriate. And yeah.
Now, back to Wellness Wednesday with Dr. Norm Shealy and Dr. Shealy-Sorin.
And folks, the time has come to talk about our favorite subjects here in Springfield. The place, the only one I recommend and use for buying my own supplements. Spring Valley Natural Foods, right there on Glenstone. I like it because you have service. In any health food store, there are probably several thousand to many thousands of items. How do you know what to get? How do you know where to go if you don't have a staff that can help you? That's what I like about Spring Valley Natural Foods. I walk in the door and they say, "What do you need?" And they tell me where it is. I don't have to go searching for it. And of course, they carry all of our goodies, the Shealy-Sorin products of our combination essentials, our magnesium lotion and
Youth
spray,
formula. Yeah.
our youth formula, all the bliss oils, but also everything else you want at a proper health food store. Spring Valley, the place where I shop, and you should too. And then I want a favorite food supplement, Nature Blessed Tart Cherry Juice Concentrate. Actually, 1 quart of it is good for a month. You take 2 tablespoons, 1 ounce a day, and it gives you the equivalent of 3.75 great fruits and vegetables out of 1 ounce. Now, I actually have to admit, I take 2 bottles a month because I like the taste of it. But it's so good for you, and it's so safe. It's found only in the produce department at real grocery stores. If they don't have it, you're in a fake grocery store. So Nature Blessed Tart Cherry Juice Concentrate, anti-inflammatory, lowers cholesterol, lowers your blood pressure, but tastes smashingly good. And, of course, now let's get on to holistic pain management. And your questions, please give us a call, 417-447-1777. Good afternoon.
Good afternoon. Am I speaking with the person?
Yes.
You are speaking with 2 people here, actually. Dr. Shealy, Dr. Sorin, and actually there's Rob here as well. Yeah.
Okay, fantastic. I'm calling to learn if Dr. Shealy has ever published or made available on any of his websites the results of his analysis and commentary of the telomere lengthening procedure he did, the 6-month second set of trials last year.
Yes, I have. Oh, of last year, no, we have not published that. The original study we did for 6 months, and we got an 8% growth of telomeres. But then the second study began at the beginning of the stupidemic, and actually the average person lost over twice what you usually lose in a year. So we are repeating the study. We're doing another 6-month study, which won't be done till the end of July or early August.
This year?
But meantime, we do know that if you use fire, earth, and crystal bliss every day, it does regrow your telomeres 3.5%. So it is, it is a way to go.
Mm-hmm.
And good afternoon. You're on the air.
Hello.
Yes. Hi.
Hi. I'm calling because I have pelvic floor muscle pain,
Pelvic
and
floor
I
muscle
do
pain.
get the PEMF
device. Wonderful. Uh-huh.
And it helped for a couple of weeks, as long as it was on, like I had it on my body.
Mm-hmm.
But as soon as I took it off, the pain reemerged, and then now it's broken through. And even with the device, I still have the pain.
Are you using magnesium lotion? If you're not using magnesium lotion, you're missing at least.
I am. I am.
Okay, you're using at least 2 teaspoons twice a day of magnesium lotion. And the only other thing that I know worth considering is L-taurine, Taurine.
Okay.
2 or 3, 1,000 milligrams of that 3 times a day may also help relax the muscles.
The other thing that I would consider in your situation is if something is getting worse after a couple of weeks, it may be worth checking it out with a doctor, with a test, with a study.
Yeah, no, I have had like the pelvic MRI.
Oh, good.
And
so it literally.
I have interstitial cystitis, but that is calm, and I even saw the urologist, and there's nothing wrong right now.
Wonderful. You did check it out. That's great. Yeah. I think the taurine addition would be fantastic, and continue using PEMF as much as possible.
And sleep with it.
Yeah.
Yeah, I do. I sleep with it, and but do you think I should move it to my head?
If you haven't used it on the head, I would use it on your head at least 2 hours every day.
Yeah.
Ah, okay. I have not done that yet.
Oh, definitely put it on your head. And if it makes a big difference, you could use it on your head only.
Okay. I'll do that.
It does help you quiet the brain more than anything.
And,
safely.
Yeah.
And safely.
Exactly.
I think, honestly, it's a guarding pain, from, earlier symptoms that just won't let go.
And yeah, sometimes we do tend to guard previously injured areas. That's very true. But yeah, let us know how it goes.
Are you doing autogenic training yet?
Yeah, yep. I do it every day I've done it for about 6 weeks now.
Oh, good.
I'm getting better at it.
Good on you.
Wonderful. Wonderful. Well,
okay, well, thank you.
Hey,
pleasure.
thank you for calling.
Yeah.
And good afternoon. You're on the air.
Good afternoon. I was on the phone with you earlier.
You need to turn your radio off.
Yeah.
I just got it.
Yeah.
I think on the call I was on with you earlier, my phone dropped the call.
Gotcha. No worries. We're reconnected. That's fine. Yeah.
You say that you were going to be repeating that?
Repeating the study. Yeah.
Here.
No, Dr. Shealy, is that going to be this year or next year?
We will finish the study by August.
Of 2021 or?
This year. We'll finish it in August.
Oh, you're already in it then?
Oh, yeah.
Oh, wow.
And,
okay.
But I also mentioned, in case you missed it, we do know that you can, if you use fire, earth, and crystal bliss every day, it will regrow your telomeres 3.5% a year. That's been published for years.
Okay. I won't hold you up any longer. Thank you very much.
Hey, thanks for calling.
Pleasure. Yeah.
And now is your turn. 417-447-1777.
And I'm just going to say this. Pain is directly, or basically, there's a linear relation between people experiencing more pain as well as experiencing more anxiety, stress, tension, depression. And, there's, let's just put it this way. This past year has been difficult on a lot of folks.
And the majority of folks, to say the least.
So I am seeing a lot more mental health issues, which always kind of go with a chronic pain, which always go with lots of other things. And the key is to address it holistically, to really use that opportunity and you take that pain and use that trigger to get to know yourself better. Why is it happening? Get to the root cause, get to the bottom line, and maybe, just maybe, you don't just correct the pain and get rid of the pain. Maybe you'll do something even better for yourself. I mean, that's just that's.
And we also believe that every human being, even from childhood, not later than 6 years of age, can benefit from doing autogenic training on a regular basis.
That's the best.
And of course, the biogenics course in general is the entire elaboration of self-control, self-regulation, and self-hypnosis even.
Yes, and there's actually a wonderful course on that, biogenicscourse.com. But there is also, as we mentioned, there's a course putting together everything that we use, everything, the theory, the practice, the tools, modalities, and
holistic pain management.
Holistic pain management. Yes, and that's available to anybody online, actually.
Speaking of online, I've had 2 reports from people they cannot find, and I've written but not gotten an answer about it. The book that we've offered for years, 90 Days to Self-Health, and signing up for my newsletter. But 2 people say they can't find it.
Interesting. We'll look into that. Yeah. That is a good book, by the way, and that's based in biogenics. That's
actually a laicized version of my PhD in psychology.
Right, self-regulation. I just want to say pain management or self-regulation is the key to controlling your body, controlling how you react, how you process the stimuli, because it's not the stimulus that gets you. And it's interesting. I've seen in my emergency room practice, I've been at it for about 20 years now. In my emergency room practice, there are people who have a high level of pain threshold, and there's people who have very low level of pain threshold. And it's interesting, the same, we'll come back to that.
Good afternoon, you're on the air.
Hi.
Hi, I own a PEMF machine.
PEMF machine?
Yes.
Okay, yeah.
And I'm unclear when it's best. I know Delta is the red light.
Delta is the red light. That's a sleep mode. Yep, that's at night.
Yeah.
Mm-hmm.
At night. When is it best to use the other 2 modes?
All day. Delta only at night.
Okay.
Actually, the general sweep is best for most people because it doesn't put you quite as deep into gamma as the gamma sweep, but it does calm the brain and produce the major effects on the whole body.
And then the second mode, which is the blue/red flashing light, that's your gamma, and that's at least, I'd say, recommend 1 or 2 hours on the cranium over the baseball cap or something of that nature.
Yeah. Like during the day, like I've been doing it when I sit and read.
Mm-hmm.
I put gamma on.
Yes.
Is that
wonderful?
correct?
Yeah, that's perfect.
Yeah. Anytime.
You can walk around with it, you know. It is battery powered, so you can put it in your pocket.
Okay, I've just been plugged in.
Oh, well, you know, you can unplug it, and it's good for 8 hours on battery life.
Yeah. Now, that another question I think I read that I recommend that it just stay plugged in all the time, that's not wearing it out. Is that correct?
Yeah, actually, I only leave it plugged in at night.
Mm-hmm.
Okay. So you don't leave it plugged in 24/7?
You don't need to.
You don't need to. No, but 8 hours will recharge it.
You know, in speaking with our engineer about this, it's not going to necessarily harm the battery. I mean, it's just, but it's not serving any purpose if you do that.
Okay. All right. I was thinking I was supposed to do that. So I will just do 8 hours and gamma when I'm reading, the chakras throughout the day, and delta at night.
That's it. Okay. Perfect.
Okay. Thanks a lot.
One wonderful question. Thank you. And now it's your turn for 174471777. Ask a question about anything because it's all related to your health.
So I was actually, I had an interesting thought that just came in, or not just, but so the pain threshold. How does, let's say, for example, the similar injury, let's say two people with the same exact injury, you can imagine whatever injury that is, and one person can actually tell me that they're in 1 or 2 out of 10, and they're sitting there comfortably or basically without making too much of a fuss, and they're not terribly hurting if you look at them. But I know obviously they're in pain. Another person can be in a 10 out of 10, crying, bawling, you know, all kinds of hysterics.
Or passing out.
Or passing out. And I'm not saying it in a bad way. I've been in a 10 out of 10 pain and in a similar state with this injury. And I know it feels terrible. But what is the distinction between that? And there's several things, several layers to it. Number one is where is a person's mental state? If a person is anxious, depressed, or stressed, or lack of sleep,
that can double or multiply.
That will triple. Now, the first night when I didn't sleep after pre-surgical, I wasn't complaining about it, but I literally felt the doubling or tripling of the same pain when I was actually less rested, and it's incredible how the body will respond to that. Also, it's your mental and emotional approach, attachment. What does the pain mean to you? Where is it coming from? And how is it limiting or not limiting your daily functions? And that's a bigger question than that.
How much fear?
Is
it creating?
Exactly.
How afraid are you of dying or being paralyzed or being unable to function? That's the degree to which you give in to the risk, if you will, the worry risk, is how much it can multiply pain. And
I want to say that in my personal example, and I've been through, unfortunately, I've had a quite adventurous lifestyle so far. I mean, I'm getting to the point that I'm.
Don't brag.
Well, it's not much to brag on. A couple of car wrecks and other things, but enough to be half bionic. I mean, metal and everything else, but. It's actually fascinating. If you allow the pain to consume you, to take over your life, to become the focus of your attention and everything else. If you literally start focusing on, is it getting worse? Is it 7? Or is it 8? Is it 9? Again, there's a value to the scale of pain, and we use it as physicians. But I would recommend this based on my own personal experience. Use the pain as a gauge as to whether you should be doing something or maybe you shouldn't be doing something. And also look at what you can do as opposed to what you cannot do. If you can walk and you can take 1 step, that means you can take maybe 2 steps, 3 steps. And exercise and movement releases endorphins, makes you feel better. So move, do things, take care of yourself, eat well, sleep as well as you can. take care of your mental and emotional state. There are supplements. And that's mentioned in the course, by the way, and there's a link online, pain management course. There's all sorts of resources, all sorts of things that we can do to help ourselves.
And avoid wheat,
Yes.
white rice, white potatoes, and sugar.
And because that's partially inflammation and beyond.
Well, it aggravates everything.
Yeah.
There's not a good calorie
Mm-hmm.
in those foods.
And last but not least, chronic pain. It does not have to mean bad living. In other words, it does not mean poor or low quality life. A person can master chronic pain even if the underlying issue or damage cannot be corrected, especially if it cannot be corrected. There's a way to adapt, to adjust, to optimize in any given situation, and that's what holistic is all about.
And again, every thought is a prayer.
Mm-hmm.
Thinking sets in motion spiritual forces to bring about change in body, mind, companions, hopes, and despair. How you focus your thinking controls everything in your life, from your health to your pain to your well-being.
And interestingly, a client comes to mind. This was a little while ago. This is a wonderful lady who came in with chronic pain, has been on multiple narcotics, multiple drugs of all sorts, has had surgery, failed surgery. So basically, classic example of everything, has been on antidepressants and everything else, and basically had no hope by the time she saw us. It was basically, in her own words, "You are my last chance." And I told her, "No, we're not your last chance, but we're the beginning of your
last chance."
Exactly. This is the beginning of a brand new life coming up, and through working on the mind, working with the self-retraining, regulation techniques that basically can help you get a hold of the pain. It's a sensation still, but it doesn't have to run your life, and to get to that place that it's not an enemy anymore. You're not fighting it, and to the degree that you can still do what you need to do, and that's what it's all about.
And again, if you have truly exhausted everything, look in the phone book or on the internet for a holistic physician. If they don't hang out as a holistic physician, you might as well not keep searching, in my opinion.
Yes.
Now, and of course, if there's not a holistic physician, I would at least consider a well-trained acupuncturist.
Well, we do see people telephone,
Well,
Skype.
We do telephone, Skype, and Zoom consultations.
Yeah.
All over the world. So if possible, if you can't find one locally, then give us a call, 417-351-5221.
One of the slides, one of the PowerPoints, we do a lot of presentations, and I love that one, is I forgot what the name of the person is, but it's something about a person. It's a cartoon, a person who has failed everything, and since you failed everything conventional, you might as well try a holistic approach, which is 98% effective at the end of the whole journey. But the question is, why do you want to wait until everything else has failed? Why wait until you've tried? Start holistic. But if you started conventional, you can always consider the option. If it's not working, Einstein's definition of insanity, doing the same thing and expecting a different results. If you're not happy, if you don't have your life the way you want it, think about the options.
I actually know a 10-year-old went back the second Saturday to watch a movie to see if it had a different outcome.
And guess what?
It did not have a different outcome.
Right.
Well, folks, again, for myself, after 6 to 12 weeks, if you are not significantly improved, conventional medicine is not going to work. It's my opinion. And there's not a disease in the world which I would allow conventional medicine on this body after the acute illness is essentially over or adequately treated.
Mm-hmm.
But think about it. With biogenics, you can do a great deal of it yourself. You don't need us. You can do the Biogenics course and do it on your own. But a consult with us is always a good possibility. And, TINS is still very useful. In fact, today, with a young lady who's recently pregnant, she has a TINS unit at home, and so I showed her how to use it when she's in labor. I actually I helped 75 women get through the entire labor process with no drugs right up to delivery using TINS to control their pain. That was way back in the 70s when I did that.
Wonderful.
Everything is possible. Very few things are impossible in today's world if you choose to take care of yourself and if you choose the holistic approach. And remember, your important situation is to make the choice yourself. Don't let somebody else make the choice for you. You need to think it out, read about it, study it, and, meditate on it to make a decision as to where you wish to move in the next step towards total healing. In my opinion, most illnesses are potentially healable if you use the right holistic approach.
Yes, and it is a decision, literally. Does a person want to go the conventional route with the maintenance of chronic disease, more drugs, more things, more problems, kind of snowball effect, or does a person want to reverse the course and go back towards health, or stay healthy? That's even better. It's a decision, personal decision, isn't it?
Well, it's very much a personal decision, and I can't make it for anybody but myself.
Mm-hmm.
I am not a twin. Even twins have different opinions. I know several couples of twins, and they are not exactly twin thinking. But the important thing is you make the decision. And again, Biogenics, 90 Days to Self-Health, the Holistic Pain course, the Biogenics course, these are the approaches and let's not forget supplements. In today's world, you also need a complementary, holistic, nutritional approach with absolute essential supplements in much greater quantity than was originally required because of pollution with Roundup and fluoride everywhere in the world.
And I think we're out of time, but for those who are interested in the course or looking into it, and it's only $49. I mean, again, we kept it low just for a reason. You can actually learn all about that and a lot more. It's just a wonderful resource.
Halitosis is better than erythritol, but pain control is far better than non-pain control. Keep the faith, babies. Until next week, have a good one.
And what do we got in questions?
Facebook Live. One question I saw is, what do you guys think about normal animal meat versus vegan meat substitutes?
About what?
Normal animal meat versus vegan meat substitutes.
I personally believe that a vegan diet is not healthy. Period.
It has to be supplemented with protein, certain type of protein, taurine, and a few other things.
The protein you get out of vegetables is incomplete.
But it's a good, vegetables do serve their purpose, no question about it. Actually, as a matter of fact, and I have actually customers and who are athletes, high-end athletes, and for them, nutrition is a little different, especially with competition and otherwise. But for regular folks, including myself, I'm not doing competition anymore. But 80-20 ratio, really. 80% veggies, 20% good quality protein, lean, stay away from carbs, and that keeps the pH of the body in a good place, and altogether it keeps you well.
The best protein, by the way, is fish.
Yes. Well,
this question actually applies a lot to the topic of today's show.
Yes.
Do you guys have any suggestions for helping with fibromyalgia?
Oh, yes.
Fibromyalgia
is at the top of the list of things that are controlled holistically. It must include intravenous vitamin C and Biogenics and, of course, the PEP device.
But also lifestyle, retraining the retraining how you how a person processes things, in working in inflammation. That's another big one. And that's just a multifactorial thing, isn't it? Actually, fibromyalgia, if I may say so, think of it just symbolically as frozen fear. Frozen fear. Something has happened, traumatic enough, and I understand post-traumatic. Simple example. I had another fracture just a couple of years ago on ice, and it was on the step of a house. I'm saying this for a purpose because I didn't think I was ever going to develop post-traumatic, but it's interesting. I discovered that when I got to that step, I would hesitate, and I would go around that step. So that's when I actually made a decision. I'm going to jump on that step every single chance I get to break through that, because again, that's how you do it. You get back on the horse and you go for it. But it's literally allowing yourself to just process and go through that mental, emotional, spiritual, physical event, whatever has caused the trauma. But in the meantime, you still have to do all the metabolic, all the physical factors, all the mental factors. And yes, we have a good degree of success with fibromyalgia, but it takes time. It takes time, and it takes nutritional, it takes other approaches. And if you're interested, of course, our clinic is certainly welcome to help with consult, or even something like, more than a consultation, just more intensive type things. And if you're
don't forget, for the people with the most severe problem, we do offer a 1 or 2 week intensive, either at home or at the clinic.
And that's basically a lot of retraining of the nervous system. That's a lot of the resetting of the what happens when the pain signals the process, and then it goes to the brain and gets processed, and how the whole thing happens to evolve from there. Because there's a lot to it. Just a simple concept. I had a person recently in a hospital, came in a coma type state. I mean, didn't respond to anything. It was a pretty terrible situation. But it's interesting how they were poked with needles to get the blood and all kinds of things, and they didn't react. It was basically pain was not a factor. But again, that kind of goes back to why is that? Because their brain, their central nervous system, autonomic nervous system, there's still the pain signal, but the processing was a different story. And how about the concept? I'll just leave it at that. A very big picture here. How about the concept of voluntarily setting yourself the intention and building yourself the mind and the brain that you wish for that? Now, wouldn't that be wonderful?
And until next week, have a good one.
Yep.